I'm Sylvia Belda. I'm the head of the Paediatric Intensive Care Unit in the 12 de Octubre hospital in Madrid. And I am the coordinator of the first program of national ECMO transport in my country. Well, I've been working in my intensive care unit since I finished my residency, so for a lot of time. And we started the cardiac surgery ECMO program in 1998. So it's a unit where ECMO has been a standard technique since ever. And we have a lot of cardiac surgery, so we are pretty used to using it. And we started the first, it was the first voluntary ECMO transport program for pediatrics and neonates in 2012. And finally, it's gotten national-wide organized this August. So it took us a long time of this voluntary program. Simulation training definitely is of paramount importance, as in a lot of centers we don't have this huge numbers, and we may have 25 ECMO runs a year, and I think in a lot of European countries we work like that. No? In some US centers they may have more hundreds of ECMO runs yearly, but I think even then there are a lot of adverse events that are highly infrequent, but that you need to be trained of and you need to know. So I think simulation puts you in this near real life experience, and you have also like you feel kind of nervous because there's someone also looking at you, and I think it makes it very realistic. And then you have the time to debrief properly and to go step by step without the whole emotions that occur in real life. No? So I think it's nowadays, when we have the technology also to have really great simulators, and this opens the possibilities now, so that even centers that do not have these big numbers or things that happen really uncommonly can be trained, and people know how to act in such a stressful situation. No? And I think it's mandatory to do simulation nowadays. No? I think we are able to learn in a safe environment. It's a lot easier to cope with what happens in simulation, even if we all want, I think, medical faculties want to do everything perfect now, because we deal with patients that are very vulnerable. So it's not easy to learn from your own errors and from things that don't go as well as we would have liked. So I think simulation has this safety and this environment to be able to open up for the experience and to try to learn as much as possible. And then it puts you in such a realistic situation that is almost the same that would happen in your unit. No? And I think you not only encounter the situation, but you also learn how to talk, how to communicate, how to be a good leader, how the team has to work together. So I think you can improve a lot of skills, not only what happens, but how you deal with it. No? So I think it's really very complete, and it may help in a lot of situations. No? And also to talk about, no? The debriefing is a very important part, and I think that also improves how you deal with it in your situation than at work. No? The numbers. No? I think in the adult world, they have a lot more patients than we have. No? And on the other side, usually we have only a few pediatric intensive care units that are trained for this. So we have to really have a great transport system so that every children in any place can be attended. No? So I think you have to really have this very good training so that you can can deal with it, no? Because the numbers are a lot lower, no? So. Yeah, I think this is like a step to the future now with the EI. There are so many possibilities. It's really easy to use it. It's friendly. It's intuitive, and that makes it a lot easier for us to deal with it because we do a lot of stuff, and simulation is just one other thing we have to learn. And sometimes when the machines are too complex, not user-friendly, you kind of have to learn for them, no? And this is very intuitive, and then the possibilities the simulator offers are enormous. It's really easy to tailor it to your situations, and I think it's really a step forward to what the future hopefully is going to offer us, no? Something easy to use and with the whole possibilities that we may encounter in real life. I definitely think that they contribute a lot because we learn skills in this near real life environment, and then we know how to use them when the things happen, no? So I think simulation is the possibility nowadays to learn for events that don't happen that often, and to learn a lot more things, no? As I said before, I think the skills are not only what I have to do, but how I do it with a team, how I communicate, leadership. I mean, the possibilities are immense, no? And as they are evolving, I think this is the future of how we have to learn, no? Not with a patient, because you shouldn't fail with a patient. So it's great if you learn it before, no? And not only young people, we still have to learn every day, no? I mean, I learn a lot of things, and such a course like this, we all learn, even if I am here as a teacher. Well, there are a lot of different people making things differently, and this is also, no? I think simulation opens the possibilities of this and of sharing also, no? Well, I had so much fun. It was great. The group here, I think there are a lot of very experienced people. So again, we teach and we learn. It's great to have these discussions where you also learn that there are different ways of making things right. And I think this is a course where the debate, the simulation, as they do it, we have a lot of fun first. And I think that's also a thing the simulation offers. It makes the learning experience really funny, no? Because it's exciting, things happen, you see how people react, and then you can talk about it in a relaxed way, no? And I think this course was amazing, and so many people from different places of the world sharing first one passion, no? Because I think ECMO transport is this one thing that we really love, no? And then, yeah, different experiences, people that work in places where they have high numbers and they know a lot, and then people from other places that also contribute, and you see that we learn from each other, no? It was amazing. I had so much fun. Well, for me, knowing the simulations has been something really important, because I think they are really user-friendly, and for me in the development of all these things, this is mandatory, because I do not have the time in my life to spend a lot of time only doing simulation or learning, no? So this way of making things easy, I think I think it will have a big market, because we do a lot of stuff in our work, and we need things that are easy to use and offer these possibilities, no? And then, of course, I always think that coming here as a teacher and then learning a lot of things from other people, no? And I think this well, in medicine it is like this, no? Things evolve and you learn from each other, and we are really a network, no? Not only the most experienced people, but a lot of things. I'm going to take home a lot of things that I learned these days. Well, I feel lucky because I participated in the both courses, and it's amazing. And I also enjoy the different locations. While on the other hand, when you have had a course that everything went well and you enjoy it, you also want to come back. No? So it's this balance of having the opportunity of knowing different people and different places, and also it was very easy to do it in the simulation center and with these simulators, and that is also, I think, definitely that at some point we want to come back here because it was really a good course. Yeah, definitely. I think it was very easy making the course here. We also had some changes last minute in the planning because we wanted to expand just a day before the simulation part, and it was really easy to do this. No, that's not always like this because, I mean, it's a course that it's quite difficult to organize because simulation has this other part that you need a lot of things, no? And so I think a place that's open-minded, that try to seek solutions when we have like a new idea, I think, and then the place and of course the simulators, I think everything worked very well, so I definitely would recommend it.